And it says we're recording. All right. Hi, friends. I am so happy to have a very cool guest on today, Dr. Chad Schaefer, to chat about pregnancy, labor and delivery, and how working on the jaw and spine can help us relax, be calm, and help ease any tension in the body. As you know, I'm really passionate about prevention and reducing pain in mamas. This has been a result of experiences that I've had in my last 4 pregnancies and my current 5th pregnancy and beyond. But one of the pearls that I have gained over 4 deliveries and prepping for this baby is to learn how to relax, be calm, and more importantly, in labor, to relax my jaw and my mind as I breathe. One of the things I learned with working with midwives is that in their world, relaxing the jaw is a really good way to ease tension in the pelvic floor and potentially help with delivering the baby. So I was always given a lot of cues like relax your face, relax your jaw, as I was going through my contractions. And a way that I approach this in my sessions is I work with women and I teach them that on the inhale that they relax their pelvic floor, and this is one of the most difficult things for the moms I work with to be able to do. It's very hard to connect. Sometimes it takes a week or 2 for them to even get that connection. But in that, they also have a lot of tension in their upper back and their necks and maybe even in their jaw as well. So I did a little bit of looking up some things, and from some education that I've had in the past is that the jaw and the pelvic floor are connected via the fascial system, and more specifically the deep frontal line. So I just thought that that was very interesting. But the other thing about it is just that our postures change. So our uterus is getting bigger because baby is getting bigger, and that's going to change our center of gravity. It's going to change the way we stand. Our feet might be a little further apart. We may be leaning back more on our heels. Our low back starts to arch a little more into something we call an anterior pelvic tilt. A lot of ladies will have really rounded shoulders. Their head will jut forward. We also see this in people just because they're playing on their cell phones and sitting at their desk. So just to give you a little example, I'd really like you to try and do that position. So, hunch your shoulders forward and bring your chin forward and take a deep breath. And now I want you to pretend it like you have one of those high ponytails in your hair and someone is pulling up on your ponytail and you're elongating your spine, and take another breath. And for me, and I don't know about you, Chad, but that is usually the easier way to breathe and to relax. Also, what I find is that for myself, when I'm stressed because I'm a mom, and my clients, if they're super stressed out, there's a lot of tension in the jaw, and so they just can't relax. So I'm really thinking there's this huge connection between being able to relax your body and this tension that you may be carrying in your jaw. So I reached out to Chad because I really wanted to maybe learn a couple of things that I could do to help prepare for my labor and delivery, practice ahead of time, because I'm always about let's prevent things, let's do what we can ahead of time so that we're not learning it in the situation. So I'm going to ask him a few questions and he's going to give us some tips. But before I do, I want to just tell you a little bit about Dr. Schaefer. And I just want to make sure I'm saying your last name correctly. Am I saying that correctly?
Yeah, you can call me Chad, though.
Okay, I'll call you Chad. So Chad is on a mission as a physical therapist to save as many patients from unnecessary surgery, medications, or injections. He owns and operates Chad Schaefer Physical Therapy in Troy, Michigan. His objectives, both personally and professionally, are to change the state of healthcare to all of his patients. In a world where healthcare experience in the U.S. is far from personal and exciting, Chad is seeking to change that. After his time spent in a typical therapy setting, he began to notice healthcare trends that increasingly became more and more about insurance and business, and less about personal connections and accountability to patients. This revolution for Chad led him to struggle to find something different and eventually led him to create a patient experience that focused on optimism, accountability, and passion. He earned his undergraduate degree in exercise science from Western Michigan University and his doctorate degree in physical therapy from the University of Michigan. His research and professional interests include TMJ, neck, and low back pain treatment and research. In addition to his physical therapy education, he is a certified strength and conditioning specialist through the National Strength and Conditioning Association. And outside of his professional interests, he loves staying active, learning, and spending time with his wife and dog. So, Dr. Schaefer, I want you to tell us a little bit more about your passion and how you can help us mamas have healthier, happier lives by preventing and relieving pain and discomfort in pregnancy and potentially labor and delivery, just bridging that gap.
Sure. Yeah. Well, thank you for that awesome and a very formal introduction, Rachel. I really appreciate it. You do a great job at connecting with anybody suffering from all those things that you were talking about, pelvic floor issues, tension, and just struggling, and a lot of things, honestly, that I had no clue about. So if I got anybody that I need to send to you, you're the person I'm sending it to. So we talked a little bit about, Rachel did a great job as far as like TMJ, what is it? What is stress in relation to like pelvic floor issues and TMJ dysfunction. So I want to talk about, kind of introduce this topic very intentionally and with a purpose, because TMJ is one of those things, and TMJ pain really, that we don't know a whole lot about in the field of physical therapy. There's some emerging research talking about this and that. What's interesting that I find, that the reason that I love working with people that have jaw pain or neck problems is because it's like, I heard this one, it was a quote from Dr. E. He's a manualtherapist.com, so credit to him. He was talking about when your TMJ hurts, your face hurts. It's just like your whole center of being hurts. And I had the pleasure, both good and bad, of having a little bit of jaw pain in the past, and it totally does suck. So if you're dealing with TMJ problems, like, know that we know that is not a very pleasant experience, and there's definitely solutions out there. So I'm going to talk a little bit about it, and then obviously, Rachel, feel free to jump in if you have any questions or whatever. So what is jaw pain or TMJ discomfort or dysfunction, and why is it important? And for this talk, why is it so important for women? Because that is honestly like 70 to 80% of the people that I see is women, and it's for a couple of different reasons. One of the biggest reasons is that women seek healthcare, or they seek help a little bit more, kind of more thoroughly than men, myself included. Like, we're just kind of stubborn as males, so we don't tend to reach out. We think that thing, I know, we tend to think that rest, I know. We tend to think that rest or ignoring it or just letting it go is just going to help. And, for a lot of people, I hope it definitely does. But what I find is it doesn't, especially with jaw pain and facial pain. So why is it important for women too? Is because if you're in a subsection of people that you're more prone to be dealing with it, like I said, it kind of stinks to begin with, but there's definitely solutions out there. One of the biggest things, and one of the biggest misconceptions as far as jaw pain, TMJ problems, is go to your dentist. They're going to be able to create the 100% solution. And a lot of times they do a lot of great work. They give you a night guard, which is, if you're not familiar with that, it just is something they're going to design for you specific to your jaw and your bite. It's just going to help with what's called Bruxism, right? Where like the pressing of the teeth.
Is that like the grinding?
Yeah. So when people say like, I got grinding, or that's pretty much what people say when they're talking about it. So that's usually the typical. Yeah.
I think my dentist made me one.
Yeah. And so you can get it, like, you can either get a custom one from your dentist, or you can get one, on Amazon. Those usually aren't as effective. So what
are helpful.
Say that one more time.
You find that they're helpful at all?
So yeah, sometimes they are. Then the night guards are, again, the biggest thing about the night guards is saying that's just one reason that somebody can have jaw pain. And I always try to write or talk to people about it, because it's like, it's the assumption that your jaw pain or your TMJ problems are coming from compression, excessive compression, and they may be contributing to it. But if it's 100% the problem and you get that, it should solve it 100%. If it doesn't, then there's probably other stuff that's going on. So just like some of the stuff you were talking about, like, that there's a connection with this or that. It's definitely a big connection between that. So
yeah, I'm interested to see like what you personally think too about that connection. Like, Mm-hmm.
Yeah, I definitely found that like, that was the biggest thing that I wanted me to create kind of a niche in TMJ and work with people suffering from this, because this is the story. They have jaw pain, they have clicking, or whatever the case is. They go to the dentist because, it's in their mouth. Dentist could take care of it. Totally makes sense.
Mm-hmm.
And they go there and they get a night guard, and it's like, here's a night guard, pick it up in a couple of weeks, and then we'll see you in 6 months and see what happens.
Mm-hmm.
And for me, I was like, oh man, it's like that's great and all, but I think there's something better out there that we can
Yeah,
do
there's
to help
more you
this.
can do to help.
Yeah,
Okay.
absolutely. And I think, again, touching on why it's so important for women, it's really good just because of I forgot where the studies were at, but it's not so much a pathoanatomical reason as far
Mm-hmm.
as the experience of pain, but there's a couple of studies that say that women actually tend to experience more pain, specifically related to TMJ symptoms. So their area in the brain under a functional MRI scan actually lights up a little brighter than males do when they're experiencing some sort of a painful stimulus. So, yeah, I thought that was kind of interesting. I don't know if you've ever
Mm-hmm.
seen anything like that.
Mm-hmm.
So,
Very cool. Um, can you maybe go on, like, I know you talked about like the clenching and stuff, but what I've noticed, like personally, and I've actually like it's got stuck before,
mhm.
and
Yeah,
I'll get like a clicking or a popping. Like,
yeah,
what is that all about? Can you tell us a little
yeah.
bit about that?
Absolutely. That's one of the biggest things that people come to see me for is clicking, pump, popping. Sometimes it's just jaw pain. I mean, TMJ symptoms can be all over the board as far as what you're dealing with. But specific to what you said, Rachel, as far as like what is it? So the popping and the clicking is when I always describe it to people as like if you are a younger kid and you dislocate your shoulder when you go to the doctor, or it just happens to kind of relocate itself. That's
Mhm.
exactly like what's happening in the jaw joint. It's
Mhm.
called a reduction, which obviously it's a
Mhm.
reduction of a joint, so the joint is dislocated, it's going back into place. So
Okay.
people that are having clicking or popping, I always tell them it may or may not be advantageous for us to actually get it back to clicking and popping, because what's happening is so if like I'm using this hand, my left hand, as the front of my face, and this
Mhm.
is your jaw, and as you open your mouth, you're going to be moving forward and down, and then when you get that click, the disc sits on top of the jaw joint, or the condyle, the mandibular condyle. So
Mhm.
when you get that popping and clicking, it's basically like it's going in place, it's going in place, and going in place.
Oh,
And
okay.
there's a really cool trick on like um, how to know if it's more progressed, or like I always talk with people about if it's easier to treat, is if you get a click or a pop as soon as you open your jaw
Mhm.
versus more towards the end, because
Mhm.
uh, anatomically, if you get it earlier on, it's good news, because it's reduced and the joints in a quote unquote good position as you open the jaw and move around. So yeah, that's kind of the spiel on clicking, popping. There could be a couple
Mhm.
other variations of that, but that's pretty much it.
Very interesting. Huh. Yeah, I haven't had it as much recently, so maybe it
Yeah,
finally has reset.
yeah.
So could you talk a little bit more about how, this maybe clenching or
Mm-hmm.
veering down, like how is that, where's the connection there with maybe stress
Yeah.
and maybe even maybe bridge the gap between that and like labor
Yeah.
and delivery?
Sure. So I think you're definitely the expert on labor more than I am. But as far as stress is related, like I can hit that pretty well, because
Okay.
one of the things is trying to be and strive to be an expert working with people with TMJ problems is it's, as we know, like every other musculoskeletal problem as a therapist you're working with, it's not just a back or a hip or a pelvic floor problem. It's a person problem, right? It's a person having this issue or that issue. So in relation to TMJ, stress management is a really difficult thing for a lot of people, and it could be in different flavors of this is stressing me out now, or it's a how they've kind of structured their life to a certain point. They're working 78 80 hours a week, and they just now start to have TMJ problems.
Mhm.
It's probably not something you did yesterday that started this. It's probably just the feather on the camel's back, or hair on the camel's back, whatever you say it. um,
Over.
yeah, yeah, accumulation,
Mhm.
accumulation. But so definitely stress management and how it relates to someone that is expecting a little one, or maybe going towards labor. And like you said, like prepping yourself to,
because we're going into labor soon.
yeah, no, but I think as far as like stress management is big. So that's like you hit on in the beginning, breathing, posture, just being aware. Body awareness is huge, because we know that the more you move, the more that you can kind of move separate joints and get smaller, more complex motions, the less pain that you'll have in general. But stress management is huge, because you can see an almost instant reduction in activity of muscles if you just relax. It's just getting to that point. That's tough.
I think I see that a little bit too in my world.
I'm sure.
Are there any like specific things that you like to tell your clients that just to help with the stress reduction?
Oh yeah, I mean, it's a whole bunch of stuff. It's very individualized, unique. I mean, one of the biggest things is I'll ask them in the beginning. So in the beginning of the subjective evaluation, which is just talking to people, really, is this, when did this come on, and when it came on, did you have any increase in stress? And I think just like a lot of other human beings will say no, but then if we try to reflect and actually be intrinsic about what's going on in life, I know from my own personal experience, you don't realize things until it kind of comes out in a certain way, whether it's like fatigue or you're overwhelmed, and you're like, oh, this is what's been kind of hitting me hard and stressing me out. So usually people will say no. Sometimes they'll say yes, and then it's hard for me. It's hard to determine, okay, is it stress 100% that's causing this? Is it mechanical, musculoskeletal? And oftentimes it's a blend. I think a blend of both for sure.
Yeah, I think we see that in a lot of our musculoskeletal injuries that we have, or function or dysfunction that we're having. So do you have any tips, maybe a few tips that you can give to help with my ladies or myself that might be having some issues with relaxing their jaw, or maybe even just having some discomfort in general?
Yeah, no, absolutely. I mean, I've got about a billion tips, but I'll give you like 3 or 4 of them. I think the first one is, like we mentioned, in relation to stress management and breathing. Breathing is one of the biggest things in relation to clenching or decreasing clenching. One of the big reasons why I'm a huge fan, and I know you are too, of active therapy or active treatment to make yourself feel better and just get on with your life, is we know it's going to be better for you versus like something passive like a night guard or a hot pack, whatever the case is. So breathing in relation to having less jaw pain and being less reliant on a mouth guard is, I always tell people, to try to keep your teeth apart and breathe. And what I find is you can do it in a loaded or seated position. That's really, really beneficial if you're on your back, because then you can, you take all that muscle activity and just kind of shut it off, and you can breathe. So, is there any tips that you use as far as breathing?
Well, I love that, because now that you just kind of pointed out, like laying down and doing it, like if I do any of my like mindfulness or just meditation where I'm just like listening to a free app or just breathing, I'm usually laying down, and it's so much easier. In fact, I actually, and I haven't thought about this with the jaw, but more like pelvic floor, I'm prepping for labor and delivery, I find it almost a little bit easier even sometimes to be sidelined, but I want to try lying on my back, or even just semi-recline, just because I'm massively pregnant right now, and sometimes laying on the back isn't always very comfortable.
No, I hear you. Yeah, I hear you.
But yeah, that makes a lot of sense, just because I would imagine that gravity then is like, you're not having a.
Yeah, exactly. That kind of leads into magically one of the other tips I use. One of the best exercises that I use for people that are dealing with jaw pain, in most cases, not everybody for sure, but it's called an isometric jaw depression. So if you think about the jaw, usually most of us eat when we're sitting up. We're not choking on the floor and trying to eat. So when we're chewing, it's pretty much you sitting and you just let your jaw open. Gravity just kind of pulls you down. There's not much muscular control. So you just kind of, but if you're like supine, you could do it sideline. I've never experimented that, but mostly supine, and you're going to take your fist or your fingers, whatever is going to be able to give you like the least amount of pressure. And all you do is just put it below your jaw. And then you're just going to gently push in a downward direction. And you're going to feel a little bit of tension probably in the jaw, and then eventually kind of underneath the beard area or underneath the chin area. So, and that's a beard. Yeah. But it's a great way, because a lot of people will clench down, and then they've got their temporalis up here is just like, hey man, I'm way too tight, let go.
I vividly remember one of my midwives in birth being like, relax your eyebrows.
I know. Yeah, exactly.
I'm like, yeah, that makes sense.
It's no fun because like a temporal headache is not very much fun. And the same thing with the masseter. If you're trying to, like a lot of the TMJ groups I'm in Facebook and whatnot, like everyone's talking about like massages and all this stuff that's going to help with tension. But if you can do a simple exercise that it does a really good job. It's just through like reciprocal inhibition, essentially turning off one muscle to turn on another one, as you know. But that's one of the
for like stiff necks. If I ever get a stiff neck, and I just do some isometric to the neck, and usually that helps calm it down.
Yeah, absolutely.
It's very interesting that you said headache, because how many women, even in pregnancy, are having headache that, I mean, yes, can be postural from our suboccipital muscles, but maybe it's also just from the tension in the jaw.
Yeah, and it's a lot of times it's the same thing, which somehow magically rolls into the next tip. It's completely unplanned, but it's fantastic. So I wrote down or typed in whatever neck retraction. So like you said, to like, so people that have TMJ problems, it's not just clicking and popping. There's a lot of other symptoms that are not as popular, which could be just like pain in the temporal region, pain in the TMJ neck itself, could be headaches, dizziness, a sensation of ear fullness is one of those weird ones that you don't hear much about. But like as relation to, like you said, in the neck, neck retraction and working on a really, really good posture is going to help. And I was actually just working with a person today, like I was telling you before the call, that was having left-sided jaw pain. And I told her, like, the biggest thing that people miss out on is, sure, you have jaw pain, but the old saying is everything's connected. And we know that the position of the jaw is intimately connected to the position of the neck. And if you can work on kind of overcorrecting the position of the neck, if that's going to be good for you, that's good. So, do you want to display good old cervical retraction? I know it's super attractive.
So I can show all my 15 chin.
Yeah.
You're asking a pregnant woman who's 40 weeks?
Yeah, let's see it.
Okay, so maybe it's not there, but
yeah, perfect. Exactly. I always sell it to everybody. I'm like, more so women, because guys really don't care if they've got 400 chin. Women are like, oh, look at all my chins.
It's like you can cover it up with your beard. We can't.
Yeah, exactly. But it's actually going to work. I always tell them you could get like a 6-pack in your digastrics underneath your neck, and then you can make your double chin go away.
I was gonna say, does it help with a little?
Yeah, exactly. That's how I get compliance with that.
I know. I was actually thinking about before this interview, like, are people like ever embarrassed to like do the jaw stuff or?
Sometimes, but the same thing. Like I always, I try to keep it lighthearted and more personal. And I'm like, I always tell them, I'm like, I'm admired, just like walking around with my neck, my neck sore, doing jaw stuff. And I forgot where I heard it, but I heard a saying: the people that do not care what they look like get way better faster, because they're going to do their stuff to invest time in themselves. So yeah,
that's great. I love it. Yeah. Well, I love those couple exercises, but I don't know if we touched on this, but do you have one like best kept secret for those who are suffering from the
TMJ? Yes. I have many secrets. Now, the best kept secret that I think we were struggling or talking about a little bit before is people that have this, if they don't either get it taken care of or just honestly know it's gonna be okay, is one of the hardest things. If they don't know that there's gonna be a solution and they struggle with it for a while, I see it all over social media when I'm talking to people and trying to give them videos or blogs or just chats. They're so stuck in, I have this, you know what I mean? Like they define themselves by their diagnosis and not by a person that has jaw pain or a person that has back pain. They're like, I'm a back, or my TMJ is this. So when they, and I'm sure you've seen this, but when they define themselves, like I've seen so many people that define themselves as having TMJ problems and they can't exercise, they can't do this, can't do this. And sure, it may be painful to do these things, but there's many other strategies that you can use to get to that point. But they don't, unfortunately, not everyone's a physical therapist or a healthcare practitioner, so they don't know those strategies. A good point of that is trying to, when somebody comes on a group and says, I got jaw pain and it hurts to do this and this, and trying as a therapist to say, exercise is going to be one of the best things, kind of sounds shitty, to be honest. I mean, it's just like, just exercise would be fine. Like I realize that not too long ago. Yeah.
Therapist.
Yeah. But I mean, that's what we know. That's a big part of the solution, but getting you to that journey to get there is one of the hardest things to do, because a lot of it is more complex than just, bones, joints, and muscles. So yeah, that's the best kept secret, though. Get out of your own head and start trying to find solutions, because they definitely exist.
I mean, it definitely makes sense not to define yourself by your condition,
Yeah.
but as you, like, I'm Rachael. I'm not, my TMJ problems.
Yeah. Just like a pregnant lady, right?
And I love that you said the thing about exercise, because it is so important. I mean, everybody knows that, but I don't think they understand why. And they're just coming out with a lot of research right now that how important it is for women to exercise when they're pregnant. And I mean, it just increases blood flow. It's going to relieve some of that tension that you're having. It's going to have this overall effect on your whole entire body. So that's really awesome. Is there anything else you'd like to touch base on, or what's important to you that you want to end with?
I don't, not that I can think of. Yeah, I guess it's just those tips of really, if you've got jaw pain, follow a couple of those tips. Ask your dentist, find a physical therapist that works with this, or chiropractor, whoever you want to go to. Doesn't really matter to me. Or just find somebody that works with it. And the best way to find that out is ask them as many questions as you can, because what I found in that lovely introduction that you gave me is like the typical healthcare experience is they'll see you because you're a patient, you're an insurance, somebody, a number to bill, but doesn't mean that they have any clue what you're dealing with, which is unfortunate. So ask as many questions as possible.
Definitely. I 100% agree. I think that as a profession in general, we can just do better. And I think it's so important to be able to give, at least my mamas, I like to give them one-on-one attention. I like to spend a whole entire hour with them. And this is just another awesome tool that I can add to my box, that when I'm helping mamas learn how to inhale and relax their pelvic floor, that we're focusing on relaxing the jaw. And maybe we even just do a few of those exercises before we start, and really just focus on relaxing everything.
Absolutely. And that's huge, because I was meeting with, I met with another PT in the area, and I told her, I was like, this is a experience like you provide. That experience doesn't exist in healthcare anymore. It's not, it's an ever fading thing, and it's going to continue to be, unfortunately. You don't get an hour with people anymore. You get like 10 seconds, and then like do a bunch of this and that, and we'll see you later. And it's just like, that's why I was so frustrated. It's like, this kind of stinks. We can do better, like you said.
How do you get through everything? And I think one of the biggest things that I recently was thinking about too is, if somebody does come in with maybe like the jaw issue, but like, oh, I need to work on their upper back or their neck, or something else, you might not be able to, because insurance is going to say to you, why are you doing that? That's not the body part, the doctor wrote the script for. So it's just very,
I mean, I've had that happen.
Yeah, me too.
That's miserable.
It is frustrating, but I mean, I love that we both are embarking on this path to help people be better, because I think that's ultimately why we go into this field, is because we want people to get better, and we want to be able to get people better in our way and what we've been taught, and then in our own just special sauce that we use.
We all have our own bias. I think that's the biggest thing of a good practitioner or a physical therapist, is admitting, like, I've had multiple students in the past, and I'm like, hey, look, this is what I know, but I know this is my bias, and this is my bias. Feel free to challenge it, and do whatever you think is going to work. But I think that's the biggest mark of somebody who at least wants to learn from other people, or just have talks like this. It's like, hey, this is what I think. What do you think? I'm not the best physical therapist in the world,
I think you're pretty good physically.
Thanks. Want to meet that guy or girl?
I think that this is just like a fantastic way to just connect one area of prepping a mom for labor and delivery, or just in pregnancy in general. So, there's like this, this global approach that we can take. This is just another tool for women to have in their box to help them prepare to be better. So I really appreciate you coming on.
Thank you.
Do you want to tell us a little bit, like, maybe how we can connect with you if we need to follow up for some disorders?
So, like you said, I'm over in Troy, Michigan. If you guys need any help, feel free to
Mhm.
contact me. You can find me on Instagram, ChatGPT PT, or ChatGPT Physical Therapy, as well as on Facebook.
Okay.
Websites, chatgpt.com. You can
Uh-huh.
look on YouTube for a funny, short bearded physical therapist. So that's me. So yeah, if you guys, I mean, any help or just want to chat, feel free. I think that's one of the biggest things that we can offer is just like
Mhm.
talking to somebody and find out if they can help you move better and just get rid of whatever you're dealing with. I think is huge.
Awesome. Well, thank you so much. We'll definitely put like your information either in the
Sure.
comments or in
Right
the
on.
so that people can see it. But really appreciate you taking time out of your
Okay.
day and from your family to be with us.
Of
And
course.
hopefully we'll connect soon.
Okay. Thank you, Rachel.
You're welcome. Bye.
Have a good night.
You too.